Hi everyone, Dr. Arpan Patel here. Today I'm going to discuss a component of cosmetic dentistry which is quite possibly one of the biggest components there is in our field today, and that is the realms of dental veneers. What is a dental veneer? A dental veneer is a thin shell of porcelain that is placed on the front surface, perhaps even the edges of the tooth, and perhaps the sides of the teeth, which enhances the shape, the size, the color, and overall aesthetic of the tooth, / the smile, depending on how many teeth you do. Now, an example of this in our real world today would be having your kitchen cabinets changed. One can either have kitchen cabinets completely changed, or one can have someone come out and just remove the surface wood of the cabinet and place a new sheet of wood on there, or a veneer wood. And it's the same concept with teeth here. Now, dental veneers are used to close spaces between teeth. They're used to reshaping teeth. They're used to recolorize your teeth. And they're also used to realign your teeth. So in essence, it is truly an all-rounder approach to getting your teeth back into the perfection that one desires. So some of the frequently asked questions patients usually have with veneers is, hey, do they chip? Do they fracture? Do they break? Do they fall off? Can I function regular foods with it? And the answer to these are no, they do not chip. No, well, I do apologize. No, they're not supposed to chip. They're not supposed to break. They're not supposed to fall off. They're not supposed to discolor. So that being said, well, how long do dental veneers last? Well, a lot of veneers have been proven to last up to 20 years. And the fact that they do not chip, fracture, break, the bond that's created between the cement and the veneer and the tooth is extremely strong. So strong that patients have reported that they're able to pretty much eat any and all foods that they were able to before. Now, granted, we as dentists cannot predict what patients eat, how they eat, what type of foods they eat. We try our best to place dental veneers in the patient's mouth with a bite that we feel is most accurate to their functional bite, and therefore there are adjustments that could be necessary after the placement of the veneers. Now, veneers is one component of cosmetic dentistry that we can sit here and say will enhance your smile. Now, the key word there is smile. When you take a look at the smile, what is a smile? Well, it's not just someone smiling. A smile is basically as many teeth as you see when you give your full and broader smile. And is that the number of veneers that I should have done? Absolutely. Absolutely, and I'll get into why. Now, when I smile, okay, you're going to see 8 teeth minimum. Okay, here's 6, here's 8, and perhaps if I'm really happy, you may see 10 teeth. So it all depends on how wide a patient smiles, which is going to be a determining factor of how many teeth one should consider veneering. Now, should one consider upper teeth as well as lower teeth for veneering? Absolutely, one can go ahead and do that. It is more common for the upper tooth to be veneered than the lower tooth. So because a lot of patients, when they smile, such as myself, all right, you're simply going to see the upper teeth. In cases of this nature, I usually recommend to my patients have the upper teeth done and go ahead and whiten your lower teeth. Now, there are a lot of patients who will sit there and go ahead and have their lower teeth veneered, which is perfectly fine. These are patients who will look at their mouth and say, look, psychologically, it bothers me to see my lower teeth not match or look similar to my upper teeth. Now, if this is the case, or if you show teeth while your lower teeth while you're talking or smiling and things of that sort, then by all means you must consider having both upper and lowers done. Okay, and that's pretty much it. Veneers usually take on average 2 appointments in a span of about 3 to 4 weeks, depending on which lab the dentist is sending the veneers to. And believe me, it's a life changer. So feel free to come on in and have a free consultation done to see how many and what type of veneers are best suited for you. Thank you. Yeah.